Well, next week, some of the most influential minds in Canadian education, disability, and inclusion will be here in Edmonton for the 2025 Inclusion Summit on Early Learning and Care. Dr. Kathryn Underwood is a professor of early childhood studies at Toronto Metropolitan University. Before hosting a session here next week, she joins us this morning for more. So good morning to you, Dr. Underwood. Let's talk about the role that childcare has in creating inclusive communities. How important is it at the core of that issue?
Well, I think childcare is one of the first places where children interact with people outside of their own homes. And so that's really important in terms of creating community, their first interactions with people who might be their neighbors, who will go on to be their classmates in the future, and hopefully their friends, their people who they're in relationship with for the rest of their lives. So I think it's really central.
Now, you recently completed a 10-year study on how it is accessing early years services. What did you find out during that study?
Well, one of the number one things we learned from families in 3 provinces and 1 territory was that it is a lot of work for families to gain access to educational services for children with disabilities. And the reason is that they have to go through a lot of bureaucratic processes, gain entry through having assessments done for their children to prove that they are in need of additional supports. And one of the critical things we believe is that we need to address some of that bureaucracy that gets attached to disability, which is creating additional work for families, which takes time away from them being with their own children.
So what kind of barriers, bureaucratically or otherwise, are you talking about?
Well, for most kids in a community, they go to childcare, they sign up and attend the childcare center. But for some children, they're being asked to get medical documentation in order to qualify for additional supports. They may be told that their children's behavior is problematic for other children and then asked to leave. That children being excluded from childcare is a serious problem across Canada. And families are then in the position of having to find alternative care for their children. And I think what we see is that where inclusion is really successful, people start with the idea that children belong there, that all children belong in their communities, and that if those children are in distress or acting out, that's something for the whole community to care about and to work on together.
You're kind of touching on it there, but why is this push towards inclusivity good for everyone in the community?
Well, when children get excluded from childcare, they have to go somewhere else. So they're still in your community, and we see a cumulative effect from exclusion. So in our study, with 159 families, we found that 80% of them had experienced exclusion from 1 or more program. And of those who had been excluded, more than 50% of them had been excluded from 6 or more programs. So we see that once a child is excluded from one space, then that tends to impact their interactions in other spaces. So it gets worse. If we can include children and work on the integration of children into their communities in the first program they have contact with, then they're more likely to fully participate in other programs. And social services and education are good for all of us and for our society.
Well, Dr. Underwood, thank you so much for your work on this and certainly for your time and insight this morning.
Thank you.
Now, the 2025 Inclusion Summit is Monday and Tuesday coming up. For more information, you can visit kidsincluded.ca.